Simulation in medical education is a technique by which you can train practitioners at all levels to perform simple technical skills as well as complex procedural skills such as laparoscopic surgery, and to practice cognitive reasoning skills by putting learners into an artificial environment where they can interact with a mannequin such as this, to take a history, do a physical exam, and then make some clinical decisions based on feedback they get from the mannequin itself and from the instructor. It's an excellent way to allow people to practice skills without harm to patients and practice to the level that they're very comfortable performing these skills before they need to do it for real. There are centers across the nation dedicated to experiential learning and simulation-based education. It's impossible to interact with a mannequin that's speaking to you as a physician and not feel anxious if that patient is not doing well. They've actually done studies where they've taken people's heart rate and blood pressure, like participants' heart rate and blood pressure during simulated encounters. And just as you would expect, the heart rate rises, the blood pressure rises in a stress response to the condition of the simulated patient. This will be the way we train nurses, docs, pharmacists, people with all types of medical backgrounds and education to take care of patients, to work together in a team setting, to handle rare but life-threatening events, to learn even basic clinical skills. With the advent of the new electronic medical record, integrating technology into the actual bedside care of patients will also be very important. We were fortunate enough to have the facility here to run a large-scale simulation. I was able to train 36 residents, several EMS personnel, and multiple new graduate nurses to work together in teams to take care of critically ill patients, some of whom were children and some of whom were adults. We were able to practice communication skills such as closed-loop communication, particularly when giving medications, which is a high-risk area during a resuscitation. And we were able to really form a bond between residents, faculty, and new nurses, and start creating more of a culture of teamwork. The future of simulation is promising here in Rochester. As a university, we're looking at ways that we can expand the facilities to allow people an opportunity to learn in innovative fashions, of which simulation is one of those. Across the university, we're developing a plan to develop a center for innovative education and experiential learning, of which simulation would be a huge component. I think medical students, when they're looking for a place to train, are definitely looking at the educational facilities and looking for state-of-the-art facilities. I think that medical students, like all adult learners, learn best by using interactive learning strategies rather than just sitting in a classroom. And there are ways to create interactive environments in the classroom also. I think the key is that education is interactive, it's learner-based, and that we help people transform from early novice physicians to experienced clinicians, and that simulation is one important aspect of helping people reach that goal.